Hey, what's up? We're going to do a 90-minute video on this bone right here. I'm just kidding. We're going to do this bone and this whole collection of bones right here. That's our plan. This bone is the clavicle. This is a nice looking clavicle right here. Now, this is a right clavicle, and it's got two different ends. It's got an end that is definitely more round. The end that is more round is the sternal end. It articulates with the manubrium of the sternum. Then we have an end that is more flattish. And the flattish end is called the acromial end because it articulates with part of the scapula called the acromion. So that is the clavicle right there. Done with the clavicle. And let's move on to its neighbor. This is the scapula right here. And this is the front of the scapula, kind of concave in the front. Back of the scapula has this nice spine here, which you probably felt on your shoulder blade. And the spine of the scapula, if you keep going, it ends in a flat area, which is called the acromion. And that's the part that articulates with the clavicle. Other things about the scapula that we've got to know. There is a process right here called the coracoid process. The word coracoid means it looks like a crow, like a beak of a crow. I don't know. I don't see it, but use your imagination. What else do we have? Well, back to the coracoid process. This is where muscles are going to attach to. This is a site of muscle attachment. And later on this semester, you might learn the names of some of the muscles that attach to it. There's also a fossa here, the glenoid fossa or glenoid cavity. This is where your humerus is going to articulate, just like that. Anything else about the scapula? I don't know. You've got to be able to tell right from left, left from right, and you cannot wear it during lab. So if in a lab exam it's sitting there, you can't pick it up and then try and put it on. You can't do that. But if it's seated like this, and I look at it and I see the spine, and if the spine is pointing to the left, I know that this is a left. There you go. Just that easy. If it's flipped over the other way, and I can't see the spine, but I can still see the acromion, and the acromion is now pointing to the right, I know it's flipped over, so I know it's a left. Anywho, let's keep going. Let's do the humerus. This is the humerus right here. Nice looking humerus. And it's got a head. It's just going to articulate with the glenoid cavity of the scapula. We've got a nice big bump right there called the greater tubercle. And we've got one right here called the lesser tubercle as well. And both kind of nice and rough. Easy to find. Greater tubercle always towards the outside. Lesser tubercle always towards the front, head always leaning towards the inside. Now, if we look at our humerus, we're going to find a bump. As I rub my hand up like this, I feel a bump. The bump that I'm feeling is the deltoid tuberosity, which is where your deltoid muscle, your big shoulder muscle, is going to grab onto this bone so you can go like this for a long time. Other things about this bone, if we go down to the distal epiphysis, we can see lots of different parts. We can see a part that looks like a little spool. I think it looks like a spool for thread. That's called the trochlea. Right there is the trochlea. Right next to the trochlea, we've got a little ball. This little ball, somebody thought it looked like a little head, so they called it the capitulum. The capitulum. So capitulum, trochlea. Next to the trochlea, we have a bump called the medial epicondyle, which is that inside bump. It's easy to find on your elbow. I should have worn my sleeveless shirt today, instead of the long sleeve. Definitely would have been more appropriate. What else? What else? We have a lateral epicondyle over here. And back to these guys. The trochlea, it's got this nice spool-shaped surface because it's going to articulate with the ulna. Here's the ulna. The ulna looks kind of like a wrench, and the ulna is going to articulate with that spool. So the ulna has a trochlear notch, which is going to articulate with the trochlea. The radius has a little concavity in its head, which is going to nicely articulate with the capitulum. What else? We flip over to the back. There's a big depression in the back. This is called the olecranon fossa. Olecranon fossa, and it actually receives the olecranon process of the ulna. So just like that, when the elbow is extended, when the joint is extended, and it fits in very nicely. There's also a coronoid process on your ulna. Don't get that confused with the coracoid process on the scapula. Okay, what else about the ulna? The ulna and the distal end has a little styloid process as well. And if we look at our radius has a head that articulates with the capitulum. It's got a radial tuberosity, which is where the biceps brachii muscle is going to attach. And it is also going to have a styloid process. So you have a styloid process on both the radius and the ulna, which is where the handcuffs go. Hopefully you don't know that already. What else? Should we do the hand?
Hand.
Let's do the hand. This is not a real hand. It is a fake hand. But what we can see is carpal bones. Those are the carpal bones. We have 8 carpal bones right there. And we've got 5 metacarpals. And we have 14 phalanges. 3 phalanges on each finger, 2 phalanges on the thumb. Proximal, middle, distal phalanx. Proximal and distal phalanx on the thumb. As far as the carpal bones, I'm going to disappoint you guys because we do not have to know all of the carpal bones. How many of you watching this out there are angry at that? Probably a lot of you. We do have to know one of the carpal bones, the one that's underneath the thumb. The one that's underneath the thumb is the trapezium, which rhymes with thumb, sort of. That's how I remember it, at least. So the trapezium is right there. The carpal bone that articulates with the metacarpal for your thumb. And I think that's it. See you later.